Many of my videos have been talking about Helicobacter pylori and the drugs. When you have Helicobacter pylori infection, clinical presentation normally range from epigastric pain, that when you have pain in your epigastrium area, and feeling of fullness in your abdomen. Sometimes the pain may be dull. You may have nausea and vomiting, and even vomiting blood. Sometimes when you have not eaten anything, when your stomach is very empty, the pain may be very worse, and this is called hunger pain. That's why we are introducing to you this particular drug called L-Syncate. L-Syncate is very important because it contains three types of medicine, or three types of drugs, which are very important in eradicating Helicobacter pylori. And this diagnosis due to Helicobacter pylori may be due to active chronic gastritis, duodenal ulcers, or even gastric ulcers. And when we are administering this drug, we have components of esomeprazole in 40 milligrams strength, levofloxacin 500 milligrams strength, and amoxicillin, which is 1000 milligram strength in relation to the tablet. Remember, this particular condition comes with hygiene. You must be very clean in whatever you do. And we normally say that when you ingest contaminated water, or even you come into direct contact with saliva, stool, or even vomiters, this may result into Helicobacter pylori infection. So hygiene is very number one key to consider when you are preventing this particular organism. Now, how do you take this drug? Even before we go into details of each and final uses of them. Now, esomeprazole, magnesium delayed release tablets of 40 milligrams. You take one tablet in the morning and one tablet in the evening. One tablet of levofloxacin also in the morning, and one tablet in the evening. And then amoxicillin, presenting milligrams of amoxicillin, which you will take one tablet in the morning and one tablet in the evening. And then complete treatment should be taken on an empty stomach 1 to 2 hours before meals, and continued for 14 days. And this is very important. And each and every packet, you can get a packet of 7 combi pits, and one combi kit contains 6 tablets. Now, what are the main functions of these components that we mentioned in L-Syncate? That is esomeprazole, levofloxacin, and amoxicillin. Now, esomeprazole is ideal PPI in eradication of Helicobacter pylori, and it's very important because it maintains the intragastric pH above 5 for longer as compared to other PPIs. When I say PPI, these are proton pump inhibitors. Now, it begins in its acid separation activity from a pH of 2.1, and its antisecretory effect lasts longer than 24 hours. That's why esomeprazole is very important in this particular drug. And then amoxicillin, which is a synthetic penicillin belonging to a group of beta-lactam antibiotics, is very important because it inhibits the penicillin binding proteins in the biosynthesis pathway of bacterial peptidoglycans, and by doing this, it also inhibits peptidoglycan synthesis, which leads to weakening of the cell wall, followed by lysis and the death of the cell of this particular organism. So it is very important in the man. Last but not least, levofloxacin. This is a third generation bacterial fluoroquinolones, and it is a broad spectrum antibiotics active against both gram-positive and gram-negative bacteria. Remember, Helicobacter pylori is a gram-negative bacteria. Now, in doing this, it inhibits bacterial type 2, Typonecerase, and Typosenecerase 4, and DNA gyrase. What a wonderful terms. And this results in strand breakage and bacterial chromosome supercoiling and releasing DNA replication, and transcription is inhibited. So by doing this drug is very important, and it will eradicate this bacteria, and you will be free of the constant abdominal pain, the constant hunger pains that are normally present in Helicobacter pylori symptoms. Now, it is very, very important in that Signature Healthcare Limited normally distribute this drug, and this drug is readily available in all the chemists nearby, but you need a prescription from a valid professional, the practitioners, to get. Though in Kenya most people just go and buy drugs over the counter, there are some no restrictions, so that's why we can just make this video without any stress. Thank you so much for watching this video. If you feel you want to know more about Helicobacter pylori and management of ulcers, watch the videos that may appear both sides, and hit the notification bell and subscribe for more videos that we post. Muchas gracias.